I'm looking forward to our third and final session of Neuroscience and Your Behavior. This week, as promised, we're going to take a step back from the primary data and primary research and immediate activities on campus regarding undergraduate education and think about how we might be able to apply the data of neuroscience, behavior, epigenetics, childhood adversity, and resilience in thinking about elevating community health. I'm honored to have our two guests that will be joining us this week. Dr. Martin Teicher is one of the founders of the field of the neurobiological consequences of childhood adversity. He's the current director of developmental biopsychiatry research at McLean Hospital and an associate professor of psychiatry at Harvard Medical School. Kimberly Green Reeves is a local community partner and a fierce advocate for community health. She serves as the director of Beacon Community Impact as part of Beacon Health Systems, one of the larger medical providers here in the South Bend, Michiana region. In preparation for our conversation, let's just remind ourselves about how we learn. Experiential learning is driven by principles of Hebbian plasticity, neurons that fire together, wire together. And in the context of nervous system development, children, infants, toddler, humans are dependent upon care for an extraordinarily long period of time. Remember, children have a neurobiological need to attach. They have no choice. For infants, in the absence of that primary caregiver, infants will die. So the idea is that human infants become attached to whomever their primary caretaker is, no matter what the experience. Reminders about what developing humans expect from the world around them. They expect things like three-dimensional complexity, social complexity, language complexity. But for a young child, an infant, the attachment figure or the attachment figures serve as a gateway and as the model and mentor towards everything else. And what we've described is an ideal system. And we all know all too well that in our current culture in the United States in 2021, that those ideal systems are not always a guarantee. So the question has become and grown into what happens to a neurobiological system when the demand on individual agency exceeds the supply of resources. We were able to learn from Drs. Valentino and Archie in our last session about some of the consequences to biology, behavior, and health. And we'll explore in this week the depth to which these things affect community health. Reminding ourselves in this community health question that it becomes all the more important to consider the brain as a situated organ and that behavior becomes an emergent property of brain function driven in large part by how we engage with our environment, but also how our environment engages with us. In the late 1990s, a seminal paper was published by Dr. Robert Anda and Dr. Vincent Folletti. It's been termed the ACEs study, ACEs standing for Adverse Childhood Experiences. This was a study, a retrospective study with over 17,000 participants out of the Kaiser Permanente healthcare system in California. And what this study really demonstrated is that childhood adversity, or really what we consider maybe more generally as stress dose on a developing nervous system is strongly correlated, increases the likelihood of not only mental challenges, mental health issues later on, right? We can understand that, right? When we all feel stressed, we might feel more cranky. When we feel stressed and we don't know what to do, we might feel depressed or anxious. We might even start to use substances a little bit more. But I think a really big frame shift in this study was that it not only had to do with poor or more negative mental health outcomes, but physical health as well. Things like cancer and heart disease, diabetes, obesity, all showed this very, very strong correlation with stress dose early in development, during earlier years in development. Dr. Martin Teicher's work has demonstrated also that this is not just a software problem, that these early experiences actually change brain architecture, underlying a lot of the changes in behaviors that we see. This is a synthesis image then. The original ACEs study looked at specific, right? We need to measure something. So 10 different factors that contribute to childhood adversity. Since this study was published in the late 90s, any number of things have also been shown, demonstrated to be ACEs on a developing system. But it's important to remember that adversity exists not only at the level of the individual, but that community events can also contribute very significantly to stress dose for a developing and a developed system. So this image here demonstrates what's called the pair of ACEs. So it's not only about those adverse childhood experiences when we're considering community health, but we also have to consider the community environment as well, and how these two environments can work together for or against healthy development within a system. Critical for community health and individual agency is understanding that on a neurobiological level, resilience is about the sum of experiences. It's not just about protecting us, right? The human world has never been safe, right? It's never been all sunshine and roses every day, right? There's always bad things that happen. There are always stressful life events. So resilience is not about protecting everybody from all the bad stuff, right? But it's about balancing, right? How can we all serve as positive, protective factors for tinier developing systems to be buffers for those stressful events that can end up doing so much damage in unbuffered situations. We're using right now a model within our community called SelfHealing Communities. 2 quotes from Dr. Van der Kolk. He is a world-renowned psychiatrist who studies childhood trauma and recovery specifically from childhood trauma. Our greatest challenge is to apply the lessons of neuroplasticity, the flexibility of brain circuits, to rewire the brains and reorganize minds of people who have been programmed by life itself to experience others as threats and themselves as helpless. Programmed by life itself. Right? Social support is a biological necessity, not an option. And this reality should be the backbone for prevention and treatment. And that's what the Self-Healing Communities model is working to deploy, taking the literature and understanding that neuroscience, behavior, epigenetics, ACEs, and resilience has to offer, mobilizing these data in actionable science ways to mitigate the impact of ACEs and reduce attributable risk and cost associated with toxic stress. We do this largely by not only providing the informational capacity, right? This awareness raising. Many of us throughout this neuroscience and neurobehavior experience might be surprised by how much the environment actually matters, especially in the context of our cultural narratives about, we're very individualistic. You got to pick yourself up by your bootstraps. This happens to everybody. Just pick yourself up and keep on going. But relationship and social support is a biological necessity. So we can take these data and we can increase agency of individuals because they do matter. So Self-Healing Communities, again, it's a preventative model, mobilizing resources within individuals, creating community coalitions around the understanding and impact of ACEs to reduce future harm and encourage healing for those of us that have experienced high stress, unbuffered toxic stress during our lifetimes. And I think this is particularly important in a post-pandemic world. Across the globe for the last year, We've all been deprived of the normative social expectations of the human nervous system. And I'm sure that we all have experiences in the last year that offer us insight and compassion into what so many people experience on a day-to-day basis, elevating the need to do something differently. How do we repair this harm, and how do we protect not only our children in the future, but how do we help heal those grown-ups among us who need healing? I am so excited about this conversation with our guests this week. I hope you are too, and I look forward to sharing this last session of Neuroscience and Your Behavior.